Everything's growing. Certainly Listowel is growing. Even in the 20 odd years I've been here, Listowel has increased significantly. There's a lot more houses and people than there used to be. Farming is different. There's a lot more bigger operations than the small family farms now. A lot of people are moving out of the cities to come into the rural areas because they want the country living and the smaller town living. As a rural small town doctor, I do a little bit of everything. So I see patients in the clinic, I do emerge shifts, I see my own patients in the hospital, I help babies come into this world, I assist in the OR, I go to the nursing homes, and I do home visits. So, what happened, Hudson?
I fell off the monkey bars.
Oh, when did you do that?
Sunday.
Sunday? Okay. As the family physician in my office, it's often I get questions. People will call me up, specifically to ask around the vaccine. Should they get it? Should they not? To try and allay their fears around it. Good news. No break. Definitely, yes. Rural areas tend to be more conservative. Some of my older farmers, they'll say, hey doc, what do you think of this vaccine? And I tell them the science, I recommend you get it. And they say, okay doc, that's good enough for me. It's Dr. Suggitt. What can I do for you today? I wouldn't know, I was inside.
Sebastian and I were building some billboards.
Back, March, April of last year, when we really didn't have an idea of what was going on and where things were going, I distanced myself from my parents because I was afraid I would bring it home to them. So I didn't get up close with them. I would stand 6 feet or more away from them. If I was in the house with them, I would stand distance from them. That's how I managed my life. That's how I did stuff because I was afraid I would be the one bringing it home. Yeah, was I afraid? Yeah. And unfortunately, my fears came to fruition.
My in-laws were afraid to go out, and we didn't want them to go out because we were afraid they would catch the virus. If you fast forward all the way to November, they relaxed the rules and they thought, maybe we'll go out in the community and get something and, shop for ourselves.
My father contracted COVID. My mom got COVID, my husband got COVID, my daughter got COVID, I then got COVID. My father got sick enough that he needed to be hospitalized. I dropped him off at our hospital at Listowel, so knowing me, I was already all garbed up, so I took him in. They allowed me to stay in the room with him. We were already in a protected room. And then when he was admitted, that was the last I saw my father in person. The next time I saw him, was via video saying goodbye.
To think that COVID doesn't affect you is very ignorant because it does affect you. Somehow, some way, it will affect you and you don't want it to. It is playing Russian roulette with life and other people's lives.
I was in the middle of trying to organize and stay strong for my mom, and so I didn't have time to be sick. So I just powered on through and did stuff, but my symptoms weren't that bad. They weren't terrible. I didn't have a high fever or anything, and I wasn't terribly fatigued. My husband was much sicker, and he actually, at one point in time, the next morning, told me that his oxygen levels were actually fairly low overnight, but he didn't want to wake me and he didn't want to go to the hospital because he was afraid he wouldn't come back either.
There was a period where I just figured I'd call my family up north and just let them know that I don't know if I'm going to make it.
The way the scientific community has been sharing information and all the stuff that came through was, it's It's mind-boggling, like to have a vaccine basically ready and available to be used less than a year after the actual disease is diagnosed and identified is just amazing. Hopefully, the science can be used to find vaccines for other diseases that are affecting people around the world. Hopefully, it prevents more people having to experience what I did.